Hello and welcome to my abstract presentation on a patient-reported outcome measures study on a single center's experience with the Rezūm procedure in the UK. My name is Oliyide and I'll be presenting on behalf of myself and Mr. Adeyoju from the Stepping Hill Hospital at Stockport NHS Foundation Trust, United Kingdom, at this esteemed ICS 2021 conference. These are my affiliations. I work with Stepping Hill Hospital and I have no potential conflict of interest to report. So by way of introduction, the transurethral convective water vapor energy, also known as the wave ablation therapy of the prostate or the Rezūm procedure, is a relatively novel, minimally invasive treatment for the management of urinary tract symptoms. A radiofrequency generator, which is outlined in this picture, provides the thermal energy needed for treatment by converting water to vapor steam. When this vapor steam gets in contact with surface tissues at a lower temperature, two things occur, and these are condensation first of all takes place and then changes the vapor steam to water. The energy is then released and transferred to the tissue, which heats up and denatures the cell membrane, leading to cell death. This is by way of convection, which ensures that each cell is reached, as opposed to conduction, where heat transfer from the energy source only applies to the cells closest to the surface or the energy source. Each 9-second treatment uses about 0.42 mL of radiofrequency treated still water vapor, and over 1 to 3 months this ablated tissue is resorbed by the body. So the aim of our study was to objectively demonstrate outcome measures from the patient's perspective, as we know that short-term outcome studies have demonstrated that there's been an improvement in the IPSS score following the procedure. So we carried out the Rezūm procedure as a day case procedure, and this was carried out in a single center in the UK. This was offered to patients with symptomatic benign prostatic enlargement as a minimally invasive procedure. These patients were quite keen on preservation of sexual function, and the first 65 consecutive patients who underwent the Rezūm procedure over a 21-month period were then sent a questionnaire. So therefore, data on the IPSS score, the quality of life, as well as retrograde ejaculation and erectile dysfunction and urinary incontinence, which occurred post-procedure, were recorded and analyzed. Also, the current medication used and their level of satisfaction was also noted. Our response rate was 58.4% out of the 65 questionnaires distributed. The mean follow-up period was 18.1 months post-procedure, and our mean age was 68 years. Our oldest patient was 91 years, and our mean post-procedure IPSS score was 8.6, with 88.9% of patients being reported as medication-free, which included things like tamsulosin, finasteride, as well as anticholinergics. We also noted a higher impact in the voiding domain scores of the IPSS as outlined in this table, and you would see from the incomplete emptying as well as the intermittency, weak stream and straining that more patients were reported in the 0, which is the satisfactory outcome. When asked about their quality of life, most of the respondents, about 65.7% of our cohort, had a score less than or equal to 2, which were mainly in the delighted as well as the pleased and mostly satisfied column. Only 3 patients were reported as being unhappy with a quality of life score of 5, and none was reported as being terrible, which was a fantastic outcome. We also noted erectile dysfunction and retrograde ejaculation in 10% of respondents, while none reported new onset or post-procedure urinary incontinence. 29 patients would recommend the procedure to others, and 5.3 patients underwent further surgery. This amounted to 2 patients actually. One underwent a TURP and another had a repeat Rezūm procedure. Most of the comments were very positive, which included things like amazing change in quality of life, being delighted, as well as absolute success from the procedure. These results therefore demonstrate the outcomes as reported from our patient's perspective. It gave us a rare insight into the quality of life which the Rezūm procedure offers, and it was not surprising to note that a higher impact was noted in voiding domains, as we all know that storage symptoms are notoriously very difficult to treat. So in conclusion, we can say that in this real-world assessment, Rezūm has been perceived positively by our cohorts. Patients' reported outcome measures are an objective way of assessing patients' perspective. We had an insufficient pre-procedure information about the erectile dysfunction in this cohort, and this may therefore call into question the erectile dysfunction rates reported here. This is something we're looking into further as regards the reported rates of the erectile dysfunction and retrograde ejaculation quoted in our study. I would like to acknowledge the support of the theatre staff in being welcoming to change and innovation in the introduction of the Rezūm procedure. These are my references, and I will be happy to take any questions or make any clarifications as required. Thank you for listening.